What's that? Oh, is this for me to wear? This is hilarious. Hey, what's up? My name is Jin, and today we're here to see Dr. Peter because, we want to fix my face. I'm kidding. We're here to talk about psoriasis and some of the treatments you can consider. Let's go. Hi everyone, my name is Jin, and this handsome young man right next to me is Dr. Peter.
Hi, I'm Dr. Peter Chung, and I'm a dermatologist, a skin specialist,
So basically, you make people look beautiful.
and handsome,
Oh, so does this face need a lot of work?
definitely.
Oh man. Oh yeah. Alright, this interview is done. Sorry guys. So, alright, the reason why we're here today is because we want to talk about something that everybody is probably not very much comfortable to talk about. So what is psoriasis?
So psoriasis is just like, your own soldiers in your body, they decided to go crazy and start attacking your own skin. Can you imagine that?
Oh,
Yeah.
So that means I'm going against myself.
Yeah, that is what we call autoimmune disease.
Oh. So does it mean that your immune system is going a little bit nuts or haywire?
But it's not the whole immune system, it's just one part of the immune system. Just a small little soldiers there creating problems.
So if psoriasis is not treated, what complications could it lead to?
Yeah, so psoriasis can also affect your joints.
Oh.
It can also affect your nails, your scalps. And we know that psoriatic patients will be at increased risk of getting hypertension, hypercholesterol, diabetes, stroke, and even a heart disease.
It's more of like a chain reaction to a lot of things.
Yeah, because we know it's inflammation. Inflammation, I always tell my patients, it's like fire. When you have fire going through your bloodstream, right? Basically, the fire can spread everywhere. It can spread to your heart, can spread to your brain, and cause problem. Yeah, so of course, earlier detection, earlier treatment will be better.
Wow. Is there like a cure for psoriasis? How does one actually treat psoriasis?
So far, we have not found a cure for psoriasis yet. But we can control the disease really, really well. That means if you want to clear your skin, it is possible nowadays with effective treatment. And so treatment, we can divide it into 3 groups, right? The first group will be topicals, creams basically. Number 2 will be light, using phototherapy light. Number 3 will be what we call biologics and also oral medications. Yeah. So for creams, patients still need to use creams, irrespective of what kind of severity of psoriasis, because their skin tends to be dry. So moisturizer is like a simple, basic things. So besides creams, we also have light treatment. But the only problem with light is patients need to come to our clinic 2 to 3 times a week, which is going to be quite troublesome, especially those patients who live far, far away from our clinics. Yeah. There's another group, we call it biologics. So biologics, they are actually proteins, but the function is antibody. The function is like a soldiers, fighting against the problematic soldiers.
So you're basically injecting sergeants into your body, and the sergeants are teaching the old soldiers how to be fit.
Exactly, So in that sense, I tell my patient, it is not cure, but it's controlling the disease.
So would you recommend or would you advise people to immediately consult their dermatologist the minute they see something like a rash?
First of all, go and see a skin specialist. If, let's say, it's indicated, we may initiate biologics. If the patient is on biologics, psoriasis is well controlled. But when you stop the medication, the chances of the psoriasis coming back is definitely there. For example, diabetes, right? If you stop diabetic treatment, your sugar is going to go higher again. So for psoriasis as well, if you stop the treatment for psoriasis will come back again.
So out of these 3 treatments, right, which one basically stabilizes psoriasis faster?
Of course, the biologics will stabilize faster. But of course, steroid also stabilize faster. But the problem with steroids is the side effect. And we will know that if you take oral steroids or you inject steroids, you're going to thin down the skin.
So all in all, it's much better to consult your dermatologist.
Correct. Get the correct diagnosis, and then you can move forward and institute the right treatment for the diagnosis.
Okay, that's very interesting. Very, very insightful. I hope everybody watching gets to take away something from this. And Dr. Peter, thank you so much for your time.
Thank you.
I hope you can fix this face in
One day.
One day.
We will, we will.
I thought he said it'll take 1 day to fix this face. How many days? How many days?
Tough.
Oh,
it's not so
man.
easy.
It's okay. It's alright, man. You can just like put some blurness over here, please. Alright. Thank you so much for watching. Of course, if you want to find out more information, there will be links in the description. And of course, most importantly, consult your doctor if you are unsure about your condition. Is this for me to wear? Yeah. Gojira.
Let's do it.
Okay. Wait.
Bring me my knife.
Wait.